Looks like we're hitting 7. I guess we're going to get started. So, all right. Well, welcome everyone. We're going to speak about diabetes today. The title of our presentation is Prevent and Reverse Your Type 2 Diabetes. I'm Dr. Rifat Kadir. What we're going to talk about in this webinar is mostly the fact that this is a preventable and often reversible disease. I'm going to cover the 3 big myths about type 2 diabetes, and I'm going to talk about the 5 keys to defeating your diabetes. And I'd like to take a little survey at this point. Just kind of curious as to how many of you guys are diabetic? Well, looking so far like I don't have, all right, then awesome. Then you guys are at the prevention stage, which is best. You didn't go down that path. So congratulations. All right, so we don't have any diabetics. I will ask the next question. Are you pre-diabetic, or do you think that you might be? And nobody's been able to tell you definitively, yes. Okay, this is the ideal group for me to be talking to, because you can totally prevent going down this path. It is not inevitable. Okay, so it looks like we've got some, maybe you're here to learn about it. Maybe you've got family members, loved ones that are potentially affected, but it looks like the majority of you are concerned that you may be pre-diabetic. All right, then let's get going here. I kind of always like to present this disclaimer that I am not doing this as your doctor. I am doing this for general information purposes. And so you must always take your health advice directly while directly working with a healthcare provider. And I will ask you to please turn off your cell phone so you can really focus on what we're talking about, so you can get the most benefit out of this presentation, okay? Thank you, I appreciate that very much. So we're gonna talk about going beyond prevention and controlling it. As the CDC says, you can prevent it and you can control it, but we wanna say, hey, we can reverse it, okay? So we wanna talk about that component as well. But most of you guys are at the level where you want to prevent it. That's awesome. We're going to go down that path here tonight completely. So what I want to say is diabetes type 2 is 100% preventable, and it is mostly reversible. Not fully reversible in all cases, really depends on how far advanced your disease is. You do not have to live with it for the rest of your life. And complications are not inevitable because you can reverse the process, okay? Question is, are you willing to do what it takes? It is a matter of personal responsibility. You have to take action. It is not passive. So I'm going to share with you a story of one of my patients, and I think you'll find this moving. This lady, I really was her last hope.
Okay, I first came to see Dr. Kadir on, it was August 15th of 2019. I actually really did think I was going to die. I was on 200 units of insulin a day with 300 blood sugars. And she just started me on a routine, slowly started me on a routine, taking, all of the blood samples, doing all that first. And little by little, within 24 hours, I had no acid reflux, which was amazing to me because I'd had it for years. And within 48 hours, my blood sugars were normal again. Well, I don't know, I must be down 30 some pounds, and my energy's so, it's coming back little by little by little by little. I'm back up, I'm cleaning my own house again, don't have to hire it out, going out with my friends again. When I first came here, it was a 9. Not quite 90 days ago, and 6.6, which tells me in another month or so, I'm going to be in the normal blood sugar. I mean, I'm going to be fives again.
So, we all say our health is our most important asset, but we don't often prioritize it. We get lost in the little details of life, and we just kind of don't put our focus where it needs to be. And it's now more critical than ever as we're going through this pandemic episode. We've kind of realized how important it is for us to be healthy to begin with. And this is where I would really encourage you to take charge. For those that don't know me, if there's any of you guys out here, totally, give you a little background. I got down this path of integrative functional medicine through some personal health problems. I had autoimmune thyroiditis or Hashimoto's, and again, I kept being told it's borderline, nothing needs to be done, but I was totally failing at residency, couldn't keep up. My husband was ready to move on. I just didn't have energy. Every step I took was a sheer act of willpower, but they kept saying, you're borderline, you're borderline. So ultimately, I was blessed in that I found a physician who actually looked beyond the standard of care and guided me to learn how to control my thyroid problem and how to take charge of my overall health. And as I did that, my energy came back. All of a sudden, I was leading 5 a.m. rounds at the hospital rather than trailing behind. And then as my parents were aging and got sick, they got into a series of health problems, which again, I had to learn more to continue to help them. And so once you start down this path, it's a one-way process. You don't go back. There's no going back. So let's talk a little bit about this crisis that we're in. Obviously, we're in the midst of a pandemic, and we're also in the midst of a general health crisis. But in regards to type 2 diabetes, 1 in 3 Americans are now pre-diabetic. 85% of these people don't know that they're pre-diabetic. And the pre-diabetics are at increased risk of diabetes, heart disease, and stroke. 1 in 10 people are actually diabetic. So we want to cover tonight, I'm going to talk to you about the truth about how and why our system fails diabetics, and how can you turn your diabetes around. Here is a scary fact that I often present, that 90% of all diseases prevalent today are not treatable with orthodox medical procedure. So what does that mean? Chronic diseases is what we're talking about. We're talking about diabetes. We're talking about heart disease. We're talking about arthritis. We're talking about these degenerative diseases. And why are they not treatable? Well, I have to kind of think about what our approach is. If I'll give you an example, if my car's check engine light is on and I take it to the mechanic and he hooks the car up and turns off the light without fixing the underlying problem, sends me on my way, my light's off for a little while, but then what happens later? It comes back on. When that light comes back on, I'm really back to where I started from. And so the same with our chronic disease management. We use medications. When the effect of the drug wears off, what happens? The problem recurs. So it recurs because the underlying cause was never addressed, it wasn't solved. So that kind of a healthcare approach is going to give you that kind of a result. Just looking at common sense, if your plant looks like this, you kind of try and figure out what is going on. Is there a problem with water? Have you overwatered it, drowned it? Is it not been watered in 3 weeks? Is it not getting enough sunlight? Has it been fertilized in the last year? What's going on in terms of, has it had some stuff poured in it that it shouldn't? You don't think, what drug does my plant need? You go through these common sense things, but when we look like this, what happens? We look like this, we're not offered, are we hydrated? Are we getting enough sunshine and vitamin D? Are we deficient in any nutrients? What's going on with the toxicity level? Have we got too much mercury in our mouths, right? Are we working in a factory that's exposing us to toxins? We think immediately about drugs. And when we think about, drugs, it isn't just happening at random, that this is the approach. What medical diagnosis does this patient have? What drug do they need? And billions of dollars are spent every year to make us think this way. So diabetes, hypertension, cholesterol, autoimmunity, these are all prescriptions for life. Just think about it. So here's a line straight out of Medicare, right? So Medicare says care that seeks to prevent disease, promote health, prolong and enhance the quality of life is not considered medically necessary. Well, geez. So promoting health and preventing disease is not considered medically necessary. This is kind of our healthcare system. This is what our health insurance covers. So if you think about it, health insurance is not for health any more than life insurance is for life. Health insurance only pays if you already have a problem. So the point of health insurance is to cover you basically once you have a problem. If your house burns down, homeowners insurance kicks in, and what does it do? It helps you helps pay for you to get a replacement. But if you want to upgrade your kitchen, it's not going to cover it. So you don't want to really expect health insurance to help you to improve health. That's not what it's all about. Health insurance is for crisis management. You don't want your health to be in a state of crisis. Does that make sense to you? So we are kind of programmed to think that that's how the system is, that our health insurance is going to keep us healthy. But I want you to really think about that. That's not the point of the healthcare system. Here's another alarming fact, that 85% of all medical procedures and surgeries are scientifically unproven. Well, geez. So why is my health insurance paying for things that don't really fix my problems? Don't they want to save money and keep me well? Well, the explanation here is that your health insurance makes money on the basis of how much money it pays out. So if it pays out very little because keeping you healthy is not going to make very much. So you wouldn't think that that's how the system is, but that is what happens. There is just too much money in keeping you sick. If the aim of the system was to keep you healthy, it would. It should. Why not, right? The system makes too much money when your disease is being managed. And I think you have to look at this. If it's possible to resolve your health issues, isn't that what you want? Can you afford to do it if your insurance doesn't pay for it? And I think what I'll ask you is, can you afford not to? This is your health. Of investing in it is going to avoid the expenses of poor health. So let's talk about diabetes, since that's kind of what we're here to do tonight. Lots of issues with diabetes. You got to take lots of medications. You've got to constantly manage your blood sugars. It's obviously very expensive. Insulin is really expensive. A lot of the newer diabetic medications are very expensive. And it gets worse. It gets worse over time. You're worried about becoming a burden on your family. Obviously, you're worried about complications. You're worried about having the complications from the disease itself. So let's start by kind of going through, what does diabetes lead to? What's the problem? Well, weight gain, which further then worsens the diabetes. So it is kind of a feed-forward circle. Blindness. Diabetes is the #1 cause of blindness in our country. And, most of us can't imagine what life would be like if we couldn't see, how we would totally lose our independence. And the joy that we get through seeing the beauty that is around us disappear. Diabetes is also the #1 reason for dialysis. 44% of all kidney failure in America occurs as a result of diabetes. 50,000 diabetics a year end up on dialysis. My mother was on dialysis as complications of another disease, not diabetes. And I tell you, it's hell. It is hell. You are tortured 3 days a week. Takes you a full day to recover in between that. So you get about 1 decent day a week. It wipes you out. Diabetes is the #1 reason for a kidney transplant. The #1 reason. And, having chronic pain, always walking on nails, is not a good way to live. And that is the first sign that you're going to have of peripheral vascular problems, which means you're not getting enough circulation to your extremities, to your feet in particular. And ultimately, that results in loss of toes or loss of foot, loss of leg, amputation. 60% of all amputations happen due to diabetes. Diabetes puts you at a high risk for heart disease and for stroke. Obviously, it's a burden on your family. When you're chronically ill or if you go blind from your diabetes, someone has to be there for you. It takes 10 years off your life. It shortens your life by 10 years. I'm going to ask you guys one other question just to kind of get an idea of the impact. Do you or a loved one suffer from any diabetic complications? Well, you guys aren't diabetes, so it's not going to be you. But do you know anyone or loved? Yes. Yeah, the complications are horrible. And they can be helped once they set in, but I tell you, it's much wiser to head them off. And this is an evil disease. It kills you slowly. Yeah, so it looks like we got about a little more, half and half of you guys that know somebody suffering from complications. These are not rare events. These happen all the time. They're very, very common, unfortunately. With diabetes, it's a matter of time under the standard of care that you're going to get diabetes. So I'd like to explore what I call the 3 myths of diabetes. And the first one is it's all about the pancreas. Right? The pancreas is our little organ in our belly that makes insulin. And so the theory is, well, the pancreas is not working right, not making enough insulin. And I tell you that's really just not the major part of the story here at all. The critical function of the liver and of all the other factors that go into diabetes gets totally ignored. So it goes way beyond the pancreas. Diabetes myth number 2 is diabetes is genetic. Learn to live with it. And what I'll tell you is that lifestyle trumps genetics. The genetics effect is about 10%. The lifestyle is about 90%. So when you see a family with a lot of diabetes, it's not because they have the diabetic genes. Mostly it's because they eat the same way, they live the same lifestyle. And this all involves excess carbohydrates, eating lots of processed foods, trans fats, lots of stress, lack of exercise, lack of sleep, nutrient and hormone deficiency, as well as toxicity. And that, again, is something that you don't hear much about. The third myth is that as long as you take your medication, diabetes is not a big deal. Well, I will disagree with that, and I'll tell you why. First of all, putting out fires is far more expensive than preventing them. Preventing them is cheap. So early detection, reversal at the prediabetes point, that's where we want to be. The problem is that even the medications, if you take them religiously, they don't prevent complications. Complications will still occur. So, the cost of diabetes is huge. 2018, the average cost of diabetes was $17,000 per year per person, more expensive than any other disease. And if drugs are so effective, why is there a diabetes epidemic? Because remember, we're managing it. We're not reversing it. We're not getting to the root cause and eliminating it. Okay? So what happens with diabetes, and we're going to talk about now how to defeat it. We've got to control these surges of insulin. Okay, so the diagram here is demonstrating glucose as a little starburst and insulin as the arrow. The glucose wants to get in your cell, the big round circle. Insulin helps. The problem is there's a block. The cell membrane receptors for insulin that open the door aren't working. And so it gets blocked. It can't get into the cell. So the problem is not that there isn't enough insulin in type 2 diabetes, certainly not initially. The problem is that the receptors aren't working. It can't get in there. So we have to control the amount of insulin, because if your body keeps producing tons and tons of insulin, the body automatically turns down the receptors. So we don't want a lot of insulin around. The other issue with insulin is that insulin is a storage hormone. It makes us gain weight. So next key to reversing diabetes is to resensitize these receptors. So that what we want to do is eliminate that red circle around the cell so that the insulin can take the blood sugar in. In a sense, in type 2 diabetes, the person has plenty or a ton of blood sugar, but the cells are starving because the glucose, the sugar, can't get in the cells. So key number 3 to diabetes is optimizing hormone balance. And this is also something, standard diabetes management doesn't go there. They don't talk about the other hormones and their impact. Cortisol is a big one. Cortisol is our stress hormone. And doctors don't even measure a level for this unless the patient is so sick that they're probably hospitalized. Chronic stress leads to a lot of strain on our adrenal system and our production of cortisol. So this is something critical to look at. And the best way for us to measure this actually is with a salivary cortisol test. The other hormones that are really critical here include the thyroid. And one of the major issues with thyroid is that it tends to be underdiagnosed because the doctors look at a level that's way too broad. We need to look at a functional range, which is more narrow, so that you're looking at more of an optimal range. So those two hormones. In addition to that, we want to focus on the sex hormones as well. So all hormones will have a component in how the system works. Okay, we want to identify and remove causes of inflammation and toxicity. Okay, that is key. We want to support the liver function so that the body can detoxify. So the point I want to drive home here is diabetes is not a blood sugar disease. The problem is much more widespread. It's not just about not having enough insulin. Leptin is our satiety hormone, determines that, hey, I'm full, I can stop eating. And what happens with insulin resistance and diabetes is that you lose that. You just keep eating, even when you're not really hungry, because that hormone that controls hunger doesn't work. So, why would your lab test be normal? Why would your doctor say you're fine? You're worried about prediabetes or whatever, and the doctor says, no, you're fine. A big part of that is based on what they test. They look at glucose, your sugar level, which doesn't go up until we're late in this disease process. And they look at the A1C, which is a reflection of your blood sugar. They don't look at insulin, okay? Simple blood test, simple fasting blood test gives a ton more information, but they don't look at it. The other thing that I see is that they don't look at the whole picture. They're looking at a little microcosm. They're not looking at the integrative function of the body. When I'm looking at a diabetic, this is kind of a minimum panel. I'm looking at their chemistries, liver, kidney function. I'm looking at that fasting insulin level, maybe a glucose tolerance test if things are questionable. Obviously the A1C, your lipids, C-peptide will let me know if you're making insulin or not. If you are on insulin, then we can't just measure an insulin level. Comprehensive thyroid panel, adrenal hormones, sex hormones, these all have a huge play in what's going on with you. So question is, can we reverse diabetes? And the answer to that is totally yes. How do we do it? Well, we order the right tests, right? We determine what the underlying causes are. We control the insulin surges. We resensitize the insulin receptors. We optimize hormone balance and function. We minimize inflammation and toxicity. And we correct leptin resistance. Well, so it's totally possible. Now, obviously, how do we do that? That's the next question, right? So let's talk about that. I like to kind of show you this diagram that simplifies the approach a bit. So we're looking at the pillars of health. First pillar is nutrition. And in that, I'm going to say that obviously your diet is very important, okay? Primarily, we want you to eat vegetables. We want you to eat healthy fats. We want you to have protein. We want you to limit processed food, eliminate it. We want you to not eat a lot of sweet, starchy, simple carbs, okay? So those are fundamentals, and we can give you more information if you'll reach out to us if you want more diet guidelines. And every patient is different, and I tend to customize these. The other part of nutrition is the supplements. You know, again, I love showing this table because it tells you, look at that. You know, the top of the chart is 100%. Look how many bars are going at around 80%, between 60 to 80. These are all the common vitamins that we're supposed to have. So majority of us have multiple nutritional deficiencies. And one such deficiency, vitamin deficiency, that's really critical. I'm going to ask you guys because I've been really trying to drive this point home, and that relates to our favorite vitamin D. Okay, so how many of you guys know your vitamin D level? And I try to encourage everybody to do so. Good. So far, I see 100, half and half. So if you don't know, your doctors will consider anything in the normal range that it's good, but I tell you, it's not optimal. And right now with infection risk and stuff, you want an optimal vitamin D level. It looks like most of you don't know. If you contact the office, even if you're not a regular patient and don't want to become a regular patient, we'll be happy to help you get a vitamin D level. Simple blood test, if you have insurance, they will cover it. You can also ask your family doctor to do it if they don't do it for you routinely, which a lot of them don't. So it looks like a lot of you guys have still no knowledge of exactly where your vitamin D level is. And so I recommend an optimal level of around 60 to 70 or so. Okay, so anything above 30 is considered normal. We know that your risk of death from COVID goes way down if your vitamin D level is above 30. And if you don't supplement, you're not going to be anywhere near 30. You're going to be way below. So again, driving home that point about the vitamin D level, okay? So, you know, a lot of doctors still will tell you that you don't need to take vitamins, get everything you need from your food, but that's not what the published medical literature is saying, okay? So clearly there is benefit to taking vitamins. This is a study from the Journal of the American Medical Association way back in 2002. And so they said, yes, for chronic disease prevention in adults, supplemental vitamins are beneficial. So there's a lot of data to support this. All right, so let's go back to the pillars of health and talk about the rest of these pillars, all right? Fitness, exercise is next, okay? It's very possible to over-exercise and then you end up harming yourself. It's also obviously possible to not exercise enough. So we want to exercise smart. We don't necessarily want to exercise hard. And with diabetes in particular, we want to not overdo to the point that we are causing more and more oxidative stress on our body. Sorry for the interruptions in the back, guys. What you want to do is 6 days a week plan on doing some exercise, and I recommend 3 days a week of aerobic exercise and 3 days a week of resistance exercise so that you can build muscle. Building muscle is critical for improving your insulin resistance, okay? So next pillar in the middle there is detoxification. This is where we focus on liver support. You know, the liver plays a huge role in how your body processes glucose and fat, okay? So when we eat, food is digested. It first goes through the liver before it goes into the rest of the body. And the liver will take all the sugar coming in, and some of it will store as glycogen. Some of it will make into what's called triglyceride, and that puts an immediate damper on how much is coming in. So if the liver is functioning well, it's going to really take charge and dampen the effect. The liver also has a big role to play in managing thyroid and adrenal hormones. It activates thyroid hormone. It synthesizes or makes the proteins that power every cell. It also makes the proteins that carry the little hormones around, like little taxi cabs. So it's going to have a huge impact on this whole process. And for detoxification, if there's one thing you can immediately act on, and that is eliminate constipation. You cannot detoxify if you are constipated, okay? Next, I want to talk about hormones. And we're talking, as I said, everything from the adrenal hormones to the thyroid to the sex hormones. They're all critical. And we want a certain balance between them, okay? Not all of us age the same. Yes, there's a general decline in hormones as we age, but some people have a much steeper decline than others. And the worse or the lower the hormone levels, the more sooner you degenerate as you age, the more frail you become, your bones become weaker, your muscles atrophy, the skin, everything just becomes weak. So very critical that hormones are assessed and supported. Next up, the neuroemotional axis. Stress is huge. Stress has a role to play in 80+% of all disease, chronic disease. I'm not talking about accidents. Well, some of those too. But stress has a huge effect, and it will have a huge effect on diabetes. If you chronically stress very hard to reverse diabetes until and unless we start dealing with stress management. And so that's an important component. Sleep is also critical. 8 hours is a magic number, 7 to 9. If you sleep less than that or more than that, you will not live as long, is what the medical literature says. They've taken healthy 21-year-olds and sleep deprived them for 4 days, so they only get 4 hours a night. By the end of the 4 days, they become pre-diabetic on lab testing. Just think about that. How many people are chronically sleep deprived? You can't improve diabetes if that's what's going on with you. Okay, so how do we do this? Well, obviously this is not a do-it-yourself thing. If you've got pre-diabetes, yeah, you can manage some of the stuff, but as you can tell, the lab testing, management, putting plans together, you really need an appropriately trained physician to help you do this. And my approach is that I start with a detailed evaluation. I showed you some of the testing that I do. So in each patient, I decide what exact testing needs to happen. For some people, we'll actually measure all the vitamin levels and so forth. For some people, we're testing them for toxicity. But once I get all that data together, then we put together a plan so that the patient has a very simple ABC 1, 2, 3 step-by-step approach. And that's kind of basically puts them on a path back to health. That's how I do it. And again, it's individualized. Otherwise, heck, I'd just write a little book and, boom, everybody's good, I retire. It doesn't work that way. We're all different. We all have different issues. We have different metabolisms. We have different genetics. We live different lifestyles. Our stress levels are different. So each of us requires a different approach. So that's where it's simple. You can do it, but you're going to need guidance. And that's where you want to find an appropriately trained physician to help you. Okay. So I want to mention also integrative therapies. This is where the integrative and my integrative functional medicine comes in. Medical ozone therapy. We have done a whole webinar about ozone, but this is activated oxygen. That smell after a thunderstorm outside, that's ozone smell. Ozone is activated oxygen. Oxygen is O2. Ozone is O3. O3 wants to go back to O2. It wants to react with everything. And there is a good bit of published medical literature on ozone, its benefit for both local disease by injecting into tissues, but also systemic disease. We're talking diabetes here in particular, okay? It helps to cut what we call oxidative stress, okay, which really degenerates and breaks down the body. So as a combination therapy, it can make a huge impact. In addition, obviously, it's not going to replace diet and exercise, liver support, all that stuff. But in addition, this is something that can make a huge impact. So as we get to this point here in the talk and I start wrapping things up, I'll share that favorite Einstein quote of mine. So, keep doing the same thing, but expect different results. It doesn't make too much sense. And you guys at this point hopefully have learned enough to make an important decision. Does this approach make sense? Is this an approach you want to follow? Are you ready to start shedding the meds, reversing diabetes, or never going down that path and preventing it? You've got what it takes. You can do this. You have to take responsibility. You have to take charge of your health. And get an integrative functional doc to help you. That is key. Don't be like the fat cat. He's got 9 lives. We think you just have one, right? We have one. Take charge of your health. If you knew what to do, are you motivated to do it? That's the question.